Good morning, everyone, or good afternoon, wherever you may be. Welcome to the Kabuki Syndrome Foundation Annual Research Conference. Unfortunately, we're doing it virtually this year, but we have a large number of attendees, so we're really excited to be able to host this today. I'm Jill Orum Dunbar.
And I'm Patrick Dunbar. We're two of the founders of the Kabuki Syndrome Foundation. We come to the Kabuki Syndrome community through our niece, Lilly, who's 15 years old and who was born with Kabuki Syndrome. We're very proud to do what we have done over the years to help support her and help support the Kabuki Syndrome community. The genesis of the Kabuki Syndrome Foundation started in the summer of 2016 when we had the privilege of meeting Drs. Bjornson and Dr. Harris at a Midwest Kabuki Carnival event hosted by my sister, Lisa Ingram. This is an event that she's hosted for several years. We were very impressed when we met with them about the research that they were working on and pursuing at the time. We began to discuss possibilities of more funding being directed towards Kabuki Syndrome research. Fast forward 2 years, and we had set up the Kabuki Syndrome Foundation along with our co-founders, Annie Dean and Dana Levinston. And at that time, we were hosting our first in-person research conference at Johns Hopkins. Dana Levinston had previously done one a few years prior, but that was the first event that we had hosted in 2018. When establishing the Kabuki Syndrome Foundation, our mission was determined to promote, drive, and fund research efforts that will lead to therapies to treat Kabuki Syndrome. It is our vision to improve the quality of life for our loved ones who are affected by this syndrome. KSF is unique in that 100% of our focus on raising money is to advocate for and accelerate Kabuki Syndrome research.
So a lot has happened in the last couple of years, and since then we have established our medical advisory board. We have expanded our board of directors, now including Leila and Eduardo Zania and Thompson Gary, who you'll hear from later. In the last year, we've also added the amazing Janet Lee as our executive director, who's been just a tremendous asset to the organization. And with Janet's help, in particular, in the last year, we have taken on several new initiatives. We have hosted a cross-institution consortium meeting with researchers across numerous teams to help foster collaboration and identify Kabuki Syndrome research priorities. We have expanded our relationships with the global medical research community and centers of excellence. We've also increased our connections with some of the regional family advocacy groups or patient advocacy groups around the world, including some in Europe, to really help ensure that patient families have a voice in setting the research priorities. We've also been working with some biotech companies and helping to consult on clinical trial readiness. So as we look ahead, we have a number of key strategies that we want to share with you. So we have set a goal of raising $5 million over the next 3 years to help fuel and influence the direction of research efforts around Kabuki Syndrome. We have 3 main thrusts of those efforts, and Tom will be speaking to them even more a little bit later, but at a high level, the fundraising efforts that we're pursuing now are going to be used to help continue to invest in the work being done in some of the centers of excellence, to also help pursue other initiatives that are enablers and help accelerate the Kabuki research happening across institutions, and to make some targeted contributions to specific research initiatives that we think hold a lot of promise. So I'm going to speak to them for a moment about our fundraising campaign. This conference is really kicking off our annual campaign. Again, all the funds raised are really aimed at supporting future research initiatives. We're really excited to be able to say that because of the generous support of a couple Kabuki Syndrome families, every donation made today and tomorrow during the conference, up to a maximum of $50,000, will be matched 2 for 1. So $100 donated turns into $300 as one example. So please do consider how you might be able to contribute and help accelerate the progress of research for Kabuki Syndrome by donating today or tomorrow during the conference. You should see off to the left on the platform in the menu, a Donate Now button. You can also go to our website. At a high level, we want to share with you a couple key objectives for this conference. Really, we've organized the content around a couple key themes here. We want to help inform and educate everyone about the research going on, recent findings and learnings, as well as work that's underway. We also want to use this conference as an opportunity to help foster more collaboration and help engage and activate the patient community. And as I mentioned already, we're really hoping to create a lot of awareness around these research initiatives and help fundraise to achieve our goals. To give you a little bit of the lay of the land, or a roadmap here, to use another metaphor, we have devised the conference agenda to touch on a number of different topics, and you'll see us kind of weave back and forth between some of them throughout the 2 days. But we want to start out by reviewing a bit of the landscape of Kabuki syndrome research. We'll have some topics around improved diagnosis and management. We want to even educate people around the different model systems like zebrafish and mouse models that are being used in Kabuki syndrome research. And then we're going to have a number of speakers talking to the latest initiatives and findings that they are working on within their teams. We also want to really help explain the idea of patient-driven research and talk about the importance of getting the patient community involved in the research that's happening. We have a crowdsourcing kind of survey or research initiative that we will talk more about later today, which provides you all with an opportunity to weigh in and tell us what you think is most important in terms of some future research initiatives. We'll speak a little bit about the role of patient advocacy groups, and we have representatives from many of those groups who will be speaking as well. And we're going to have some discussions around the opportunities for participating in research and engaging in some registry and database programs that can really help enable other research initiatives. And then we're going to talk about what it takes to do some of this work and what kind of funding is needed and where the gaps are. But ultimately, our key goal with this conference is to really help bring everybody together to develop a collaborative research network here that involves strategic partnerships, and importantly is going to help pool resources to have a bigger impact, to help increase knowledge sharing and accelerate these research efforts. So it really comes down to creating a connection between the patient community, the research and practitioners, and the biotech and pharma arena as well. So we're hoping to help serve that role as a foundation to create those connections and bring those three things together.
We just want to thank two of our key sponsors, Horizon and CBX, who are our platinum sponsors for this event, who have been huge supporters of this effort, and we couldn't do this without them. So thank you very much for your support.
Absolutely.